43-year-old male fell and struck his right ribs on a metal railing. He has severe right-sided chest pain and paradoxical chest wall movement with breathing. What's the diagnosis?
This is a pretty gnarly example of what we call flail chest, typically caused by blunt thoracic trauma. Flail chest is defined as fractures of 3 or more ribs in 2 or more places, which create a floating segment that loses its mechanical continuity with the remainder of the chest wall. The fractured portion of the rib cage, or the flail segment, separates from the rest of the chest wall and moves in a paradoxical motion on respiration. Normally when we breathe in or inspire, our lungs create a vacuum by contracting the diaphragm and moving it downward, causing the rib cage to expand. This causes a negative intrathoracic pressure during inspiration, which allows air to enter. Then when we expire and breathe outward, the diaphragm relaxes, causing positive intrathoracic pressure, allowing air to be pushed out of the chest cavity. When we have these rib fractures, the flail segment moves with the intrathoracic pressure and is no longer held in place with the entire rib cage, moving inward during inspiration and outward during expiration.
Treatment includes primary and secondary survey, pain control, oxygen therapy, pulmonary therapy, positive pressure ventilation if needed, and eventual surgical rib fixation with or without chest tube.